about cancer, eating well with head and neck cancer, hosted by the Cancer Support Community. If you need technical assistance during the webinar, please dial 866-229-3239, option number 1. Before we start, I'll go over some reminders and housekeeping items. If you would like to listen to today's presentation via telephone, please dial in using the conference line code you see on the screen. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org/webinar within the next few days. The format of today's webinar will be as follows. The panelists will present first, and then we will open the discussion up to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. If you would like to ask additional questions, please feel free to type it into the Q&A box on the right of your screen. You can submit a question at any time during this event. Then at the end of this webinar, you will be automatically redirected to the post-webinar survey. We ask you to please take a few minutes to complete this survey because your input is of great value to us. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor when making treatment decisions. The final program is CSC's Landmark Education Series, our Frankly Speaking About Cancer program, where we provide trusted information on a variety of topics important to people affected by cancer. Information is available through print and digital publications, online, and in-person programs. For the complete list of publications, please visit orders.cancersupportcommunity.org. I would also like to introduce our Cancer Experience Registry, which is a unique project for people affected by cancer. People who have been diagnosed with cancer and those who help care for them can join the registry. You begin by answering survey questions. Your answers and those of others describe the experience of cancer patients and caregivers. This information is used to provide education and support resources that speak to patients, caregivers, and their needs. For more information or to join, visit www.cancerexperienceregistry.org. Finally, I'll take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you'd like to learn more about this program or to sign up, visit our main website at www.cancersupportcommunity.org/join-our-movement. I would now like to introduce today's panelists: Jessica Iannotta, Dave Roff, Thea Roff, and Amanda Hollinger. Jessica is the Chief Operating Officer at Saber Health, an evidence-based, personalized oncology nutrition technology platform. She is also a registered dietitian and certified specialist in oncology nutrition. She studied nutrition at Cornell University and completed her dietetic internship at New York Presbyterian Weill Cornell Medical Center. She obtained her master's degree at Rutgers University. Before joining Saber Health, Jessica worked in inpatient and outpatient oncology at the Northwell Health System. And then Dave Roff. Dave is a career optician who had 25 years in the industry behind him when his cancer forced him to stop working. Thankfully, he is now back on the job, which is the best therapy available. He is also a former professional musician who now enjoys playing piano, writing music, and recording as hobbies. During his convalescence, he also tried his hand at being an author and wrote a book about his experience, which was published and is currently on the market. And then Thea Roff. Thea was a long-term managed care coordinator for a major insurer, but her desire to work with computers drove her back to school later in life, finally obtaining her bachelor's in information technology. She is just now realizing the career change she has worked for. In her spare time, she enjoys knitting, crocheting, and various other crafts, computer gaming, and her family of pets. And then Amanda Hollinger. Amanda is a nonprofit consultant living in Charleston, South Carolina. She became interim director of the Head and Neck Cancer Alliance in May 2018. She previously served as director of sponsored projects at Trident Technical College, where she led the development of grant proposals, resulting in over $20 million raised. She's been executive director of the YWCA of Greater Charleston and project manager for the Head and Neck Cancer Foundation in 2008. Amanda received her bachelor's degree in English from Guilford College and her master's degree in public policy from the Humphrey School of Public Affairs at the University of Minnesota. She is active in various community organizations, and in her free time, she enjoys cooking, running, creative writing, reading, traveling, and spending time with family. So I will now ask Jessica to start us off with what will be covered in tonight's webinar.
Thank you, everyone, and thank you, Claire. It's a pleasure to be part of this webinar tonight, and I look forward to sharing some really great information with all of you. So tonight we're going to cover a bunch of different topics related to head and neck cancer patients and the importance of nutrition. First of all, we're going to discuss the benefits of nutrition for head and neck cancer patients. We're also going to review the nutritional impact of head and neck cancer treatments, the importance of the oncology dietitian and the healthcare team, and helpful tips to manage common nutrition-related side effects and optimizing nutrition during and after cancer treatment. So let's move on to the next slide. So let's talk about why nutrition is important. You know, one of the reasons why I became an oncology dietitian is simply because nutrition can have such an impact on cancer care and for cancer patients. And I really enjoy being able to watch patients thrive through proper nutrition. So first of all, nutrition can make an impact even before cancer treatment starts, before, during, and after head and neck cancer treatment. There are so many side effects that can affect food intake and nutritional status. Even before treatment begins, patients can have side effects from the initial tumor. Things like difficulty swallowing, mouth soreness or pain, or even weight loss. And that might be some of the initial signs that something's wrong. In particular, one study that I'm aware of found that up to 25% of head and neck cancer patients were in fact malnourished before treatment. And that number rose to as high as 85% after radiation therapy. So clearly, nutrition is key and such an important part of head and neck cancer treatment. So let's talk about some of the benefits. First off, during head and neck cancer treatment, nutrition can actually help prevent treatment delays. We know treatments can be things like surgery, and that usually it starts with surgery, include radiation and chemotherapy, and often it varies based on the type of the cancer, the location, or the stage of the cancer. So having proper nutrition from the very beginning and being proactive can help prevent delays that can actually impact the outcomes of treatment. So not only preventing those delays, but improving outcomes, preventing hospitalizations or lengthy hospitalizations, preventing weight loss and malnutrition, and also preventing and managing treatment-related side effects. And we're going to talk a lot about that later on in the presentation. And I know Dave will also share a lot about his experience with some of his own personal side effects as well. So let's talk about benefits of nutrition after treatment as well, because I know we may have some people listening who may have completed treatment and are kind of in their next stage and their next phase of their cancer journey. So nutrition can also help manage weight loss that can occur during treatment and help you to work on gaining weight and optimizing your nutrition to get stronger. It can also help you cope with a lot of the lingering side effects from treatment, and we'll go through these a lot when we talk about side effects later on in the presentation, but oftentimes, you know, your taste buds might not come back right away, or you may still not have much of an appetite. Your sense of smell may still be highly sensitive after chemo. So there are a lot of things that can kind of linger even after treatment is complete, and that's where nutrition benefits you even afterward. Not only that, but a healthy diet and lifestyle is always important, right? So healthy diet and lifestyle can help you into that next realm of survivorship to keep you strong once the treatment is complete and keep you healthy for beyond, to prevent even further complications or things that can arise later in life. A healthy diet prevents a lot of chronic diseases, things like heart disease, diabetes, or even a secondary cancer diagnosis. So good nutrition is important throughout the cancer journey. So now we're going to talk about some of the nutritional impacts of the specific types of treatment that I mentioned earlier. So first we'll start with head and neck cancer surgery. And I know Dave will definitely share more of his experience later on with some of these specifics that he went through. But in particular, there are some specific symptoms that head and neck cancer patients often experience after surgery. These can include decreased appetite, difficulty chewing and swallowing simply because there may have been some dental extraction or removal of part of the jaw, or perhaps even some reconstruction or implants that affect your ability to eat normally and to chew and swallow. There may be mouth soreness or pain postoperatively, even potentially some numbness, changes in taste, things that feel different in the oral cavity make it not so pleasant to eat. So this can make nutrition and eating proper nutrition quite challenging at this time. It is possible that some patients may actually even require a feeding tube during head and neck cancer surgery, especially if the clinician expects that swallowing will be impaired for more than just a few days. Post-op, they may actually put in a feeding tube through the stomach to help support nutrition for healing after surgery. And then there's the nutritional impact of chemo and radiation as well. So after a patient heals from surgery, often the doctors will make the plan for both chemo and RT, which are quite commonly done concurrently. And nutrition has a big impact because that's a heavy-duty schedule for a lot of patients to do chemo and RT at the same time. They'll often experience decreased appetite, especially a lot of fatigue, simply because the demand of that kind of schedule in and of itself is quite tiresome. But the radiation has a known side effect of causing fatigue, and that can last for quite some time. Even weight loss, simply because of the lack of appetite. The radiation, because we're radiating the head and neck area, you're going to experience dry mouth, a lot of, maybe mouth soreness, trouble swallowing, a lot of change in taste or flavor, the way things taste and feel. It may be a lot harder to swallow because of pain or impairment even from the surgery that can remain, making the muscles weaker and harder to swallow. And then the chemotherapy drugs often have side effects that can aggravate the lining of the stomach. So those often bring about feelings of nausea that can come and go. Sometimes it can result in vomiting as well, but usually within the medicines that we use nowadays, it does control a lot of the vomiting. And nausea is, usually nausea can be quelled pretty well with a lot of the medications and also some of the strategies I'm going to discuss later. And then you may also experience diarrhea or constipation as well as a result of all the medicines. So we talked about why nutrition is so important, and it's really clear that the role of nutrition, especially proactive nutrition is just so important in the head and neck cancer journey. But oftentimes it's hard to know where to begin, and it can be quite overwhelming, because you can do a search on the internet and come up with thousands of results telling you probably a million different things and a million different ways to go about it. So my recommendation is one of the most important places to start is with your healthcare team. Ensuring that your team is right on the same page as you and getting your nutrition plan together. So most oncology facilities, especially nowadays, usually have an oncology dietitian on staff. He or she may not be full-time, but usually there is somebody that you can take advantage of, and I would make an appointment as soon as possible and throughout the treatment process as well, and afterwards, for follow-up. Weekly follow-ups are so important. When I was working in the radiation oncology setting, working with my head and neck cancer patients, I would see them every week right after they saw the doctor. So for their weekly check-ins with the radiation oncologist, I would usually kind of pop in afterwards to check in and see how their nutrition was doing. So similarly, it's a good idea to get in touch with a dietitian, kind of around that same schedule. Regular follow-up is just so important because the sooner that a dietitian can help you address weight loss and malnutrition and any issues that you have, the sooner the better, because we can really help prevent a lot of the complications, severe weight loss and malnutrition. The dietitian helps you to manage your symptoms, gives you really specific individual tips to help you get through. He or she may even give you a specific meal plan that's tailored to your dietary needs and preferences so that you have something really personalized and individualized to follow that's tailored to what you're going through. So it's a really key part of the process of really managing your nutrition throughout your head and neck cancer treatment. In addition, you have your physician, you have your speech-language pathologist, you'll have the nurse. They'll all be checking in regularly as well and asking you, how are you eating, how's the weight doing, monitoring your symptoms. But it's also important to know, bring any problems to the attention of your team as soon as possible, because the sooner they can create a plan to address it, the better off you'll be. And the sooner we can proactively address any nutrition issues, we can prevent, like I said, any unnecessary weight loss and help keep nutrition as optimal as possible to get you through the treatment. So things like any severe weight loss, really not being able to eat or drink anything by mouth, any consistent coughing where you feel like something's going down the wrong way, persistent side effects, something that's, I'm just always feeling nauseous and it's just not going away. Even if you feel like I can't even get through the day, I'm so tired, I can't even do my normal tasks. Or even if you have a feeding tube and something's wrong, it's not working correctly, bring it to the attention of your team right away so we can get to the bottom of it and get you better. So that being said, as I mentioned earlier, there are a lot of patients who are prescribed a feeding tube, whether it's prior to radiation treatment or during radiation treatment. It can be placed at either time. It's actually a relatively simple procedure. And a lot of times patients who really, if they're not able to consume by mouth consistently at least 50% of their nutritional needs by mouth for at least, for a week or more, and if the doctors and the dietitian don't see any realm for improvement post that 1 week of difficulty, it is something that we would like to, start sooner rather than later, because the sooner we can get in nutrition and get that support in, the better the patient will feel, the stronger they'll be able to recover and heal. The mouth will be able to heal more quickly. And we can also prevent, potential hospitalizations due to dehydration, because obviously if patients can't eat well, they also can't drink enough fluids to stay hydrated. So it's usually a decision that's made collaboratively. So the dietitian, the radiation oncologist, the speech-language pathologist, the nurse, and the patient will all coordinate together to decide, the right timing and if a feeding tube is appropriate for each individual patient. I would say the most important part of nutrition support during head and neck cancer treatment is that even patients who are using a feeding tube, one of the most important things is to remember to continue to eat and drink regularly. And the reason why this is important is that it allows the muscles in the throat to stay strong enough to continue that ability to swallow, and kind of like almost like a muscle memory. So it allows those muscles to stay strong for the swallowing function to continue appropriately. And so even when patients aren't necessarily eating by mouth and relying very heavily on the feeding tube, we usually encourage them to continue special swallowing exercises to help keep those muscles strong so that the swallowing function is not impaired once they are able to eat again. So just like I discussed earlier, important questions to bring to the attention and important issues, especially with a feeding tube, it's important to pay attention to any potential concerns and bring them to the attention of your medical team. Things like digestive problems. If you feel like the formula is regurgitating or you're having a lot of digestive issues, in particular, what I tend to see is a lot of like maybe cramping or bloating. It may be a specific ingredient in the formula that you're sensitive to. The dietitian can usually help recommend an alternative formula. You may be bolusing it in too quickly. We may have to space out the feeding times a little bit. But there's a lot of adaptations that the team can usually easily recommend to help a lot of the common digestive problems. But it's important. We need to monitor your weight, making sure you're still getting in enough calories and taking in enough formula. And then using the tube properly, cleaning it and flushing it appropriately before and after each feeding. And usually we have you flush it regularly throughout the day, too, because we want to keep it clean. And then sometimes patients also may have some challenges in terms of getting certain formulas approved by the insurance company. So that's usually where the medical team and the dietitian, I've been involved in many of those scenarios as well, and it's definitely a place where we can help the patient get what they need. So now that we've gone through some of the different aspects, overall aspects of treatment, I think it's really important to talk about some of the specific nutrition-related side effects and give you really individual recommendations for each side effect that can help, because there really is a lot you can do when things aren't feeling well, and nutrition can really, really help a lot of the common side effects of a head and neck cancer treatment. So we can start with mouth pain and mouth sores. Obviously, this is one of the most common ones that I, as a dietitian, have dealt with my head and neck cancer patients, as I mentioned earlier, simply because radiation therapy is directly targeting, the oral and head and neck region. A lot of times that's, really going to cause a lot of irritation and soreness in the mouth and throat. So one of the first things we recommend is choosing foods that are more soothing. So especially things like cold foods can have more of a kind of a numbing effect and tend not to be as irritating. Things that are really soft and mild, things like cottage cheese, yogurt, smoothies, creamed soups, these are all very gentle, so they're not going to be too irritating to a sore mouth. And then meals that are really well cooked, things that are really soft. I usually use my rule of thumb is that if something is tender enough to cut or mash with a fork, then generally that would be something that's a little more tolerable to the oral and digestive cavity as well. And then, of course, overly acidic foods, things that are very tart, things like citrus foods, so like an orange juice or eating an orange or something with lemon or lime, tomatoes or a tomato-based sauce. So, a lot of Italian foods tend to be a little more irritating. Things with a lot of spices and like curries and hot peppers, crunchy, hard foods, chips, pretzels, breads, hard, crusty breads, things like that, are also things, that are generally more irritating to the mouth. In addition to, alcohol, things that are generally more irritating on a good day when we have mouth sores and mouth pain are definitely way more challenging. And then also it's important to rinse your mouth before and after meals. So one of the things I have my patients start from the very beginning is a mix with baking soda. In a quart of water, you mix a teaspoon of baking soda and half a teaspoon of salt. You make a fresh batch every day, and then you just swish and spit a little bit, like roughly a couple of ounces. before and after meals. You don't swallow it, so it's important to remember not to swallow it. But that's a really great way of kind of cleansing the palate, and it really does help not only with some taste irritations, but it cleanses and clears the mouth before and after meals. So it's a great habit to get into. Even if treatment is complete and the mouth still isn't up to par, it's a great thing to try. Sucking on ice chips, once again, that numbing effect of cold foods, and also drink through a straw, because that's a great way to divert beverages, liquids, and kind of liquid foods to avoid the sore spots. I can't emphasize enough how important it is to take good care of your mouth. And I know the dentists always say this from the very beginning to the head and neck cancer patients, because good oral care is just so important in preventing a lot of the unnecessary oral irritations and oral discomfort. Brushing and flossing daily as directed by the doctor or the dentist. Rinsing with alcohol-free mouthwash, using that rinse I just mentioned with the baking soda. Making sure to follow up with the dentist because they're probably going to want you to continuously use the fluoride toothpaste. They can give you some good little tips and tricks of different rinses as well for dry mouth and things like that. There's some gels that work really well. So follow up routinely with the dentist and take good care of your mouth. And after treatment, this is important as well. So oral care throughout is really key. So now moving on to kind of, I would say probably the next most common issue would be difficulty swallowing, and it also encompasses difficulty chewing as well. Just to choose foods that are really soft and easy to chew and swallow. So it tends to be a lot of things that are soft and blended, protein sources especially. Unfortunately, delicious-looking steak, as much as people may crave it, is not going to be something that will work that well when swallowing and chewing are an issue. So things like a nice soft, flaky fish, ground meats, a nice soft scrambled eggs, beans that are really cooked tender and can easily be mashed with a fork. Very similar concept like I mentioned before. Things that are soft, easy to mash, generally tend to be easier to swallow as well. And for this population, in patients where swallowing is a real issue, I tend to use a ton of nutritional beverages. So there's a whole variety out there in the market, and your dietitian can help you find the one that is best for you. There are definitely a lot of good ones for head and neck cancer patients. You can even make your own. There's some great recipes that the dietitian can share for milkshakes, smoothies. We have a lot of great recipes in our booklet as well that you can look at, the head and neck cancer booklet that just came out. And these help because they get in a lot of calories in a really small volume. So when eating is hard and it's hard to get in enough because your mouth and your throat really feel sore, at least if you can drink in some of the calories, it's a great way to keep up your nutrition. And then, of course, avoiding things that cause irritation and pain, just like I mentioned with the mouth soreness. Hard foods, things that are really tough and chewy that would be really tough to swallow. And then a great way to make foods easier to swallow, pureeing in the blender. I mean, it may seem kind of strange to think about, taking, let's say, a ground meat stew or one of your favorite dishes and putting it in a blender, but if you add enough kind of chicken broth, vegetable broth to the blender, most foods can pretty easily be pureed, which is a great way to enjoy that same taste and flavor but make it easier to swallow. And then even adding extra sauce, dressings, things to moisten your dishes usually can do the trick as well. So it's always good to have extra on hand, especially if things are starting to get difficult or if it's an issue that's been persistent for you. Some patients also have difficulty swallowing for another reason related to that muscle, kind of the weakening of the muscle that I mentioned earlier, the muscles of the throat. So in those instances when there's difficulty swallowing, sometimes patients actually need a thicker consistency of food so that the food goes down the right way, because when the muscles are weaker, sometimes the food can have a tendency of aspirating, which means it kind of spills over into the lung. So in that case, a speech-language pathologist is usually involved and helps the patient to learn how to use proper thickeners There's commercial thickeners on the market. Sometimes things like cornstarch or even gelatin can help thicken foods to the right consistency, so that when that patient will swallow, even though the muscles are weaker, it helps the food to be heavier and thicker to go down the right way. So one little kind of tip that I found really helpful, and that the oncology nutrition community usually recommends patients to protect their throat during radiation, is a spoonful of honey. That actually can kind of coat the throat and has a protective kind of antibiotic effect in the throat as well. So honey is a really great thing. All you need is a spoonful before each radiation treatment, and it may have actually a protective kind of soothing effect on the throat. So that's something to try as well, kind of a natural way to help coat the throat before and during radiation, or even afterwards if you're still experiencing some throat soreness or a discomfort. But most importantly, if it really is persistent, if the difficulty swallowing, if coughing, regurgitation, if it just doesn't feel right, it is important to bring to the attention of your medical team, because a speech-language pathologist may need to get involved to really help determine, if that special dietary consistency is necessary, and then just to make sure that too much food isn't, aspirating into the lung area, and that you can swallow safely. So just be mindful of that if it does get too difficult. Okay, so now dry mouth. This is a really big one as well, simply because a lot of time, because we're radiating the oral cavity, there may not be as much saliva produced. Usually because patients aren't eating and drinking as much. Also, too, patients tend to be slightly dehydrated. Once again, another cause to not have as much kind of saliva and more of a dry mouth feeling. So this can be really uncomfortable and often makes it kind of difficult to not only to eat, but to also kind of, just talk. You always have that kind of cotton feeling in your mouth. So there are some helpful suggestions, and I know this is one that Dave definitely dealt with as well, and he can give us some of his personal experience later on. But as a dietitian, some of the things I recommend is to stimulate the saliva. So sugar-free gums, sugar-free sucking candies are a good thing to kind of have on hand. Sometimes that can help to allow the saliva to be generated a little bit more in the mouth or in the oral cavity. And then choosing foods that are moist already gives you that advantage, so that it's a little easier to eat even though your mouth is already dry. Eat something that has a lot of sauce or a lot of gravy to it, let's say a casserole or a stew or a soup or something like that, generally is easier to eat with a dry mouth. And make sure to drink enough. Like I said, dehydration is a big factor in mouth dryness as well, and is important to kind of sip on fluids throughout the day as best you can. The dry mouth, similar to the sore mouth, things can still be irritating. So as long as the acidity of foods doesn't really bother you, or if you can tolerate, sometimes that acidity can also help stimulate saliva as well. So that's dependent on whether or not the mouth is also sore at the same time, but sometimes a little squeeze of lemon or a little citrus can actually help to kind of, that tartness can get the saliva going a little bit. And then drier foods, as I said, choose moist foods. Avoid things that are kind of, think of my perfect example is peanut butter. So think of peanut butter. A normal spoonful of peanut butter on a good day is not so easy to eat. So when your mouth is really dry, that's definitely a tough food. So try to limit things that are kind of normally harder to swallow and chew, and go for the moistest options you can put together. Other things that can aggravate a dry mouth, things like alcohol, caffeinated beverages. It is important, especially for mouth rinses, as I mentioned earlier. Even though mouthwash is a really important part of oral care, it's still important to get an alcohol-free variety of mouthwash. And as I mentioned too, dentists usually have some good suggestions. There are actually special mouth sprays, rinses. Dave may be able to tell us a few that he particularly found helpful. Even saliva substitutes, gels that do help with dry mouth as well. So there's plenty of products out there that that can definitely help you as well, kind of in between the, drinking and all of the other food suggestions. Make sure to protect your lips because, of course, dry lips are really prone to cracking and irritation. Use plenty of lip balm, petroleum jelly. Sleep with a humidifier. Help keep the room moist. All those things can make a dry mouth even worse. So just to kind of be on target to help not only your food but help your environment to help moisten your oral cavity as well. Okay, so now we'll talk about changes in taste. I have to say, change in taste is probably one of the biggest side effects that I counsel patients on that tends to last longer than the others. It's not uncommon for some of my head and neck cancer patients that I've worked with to still have some changes in taste. It could be 6 months or a year or even longer. Everybody is different, and everybody's body takes different amount of time in getting their taste buds back. So the best thing I can recommend is not to get discouraged. Foods may taste different, things may smell different. It may vary from day to day. But the most important thing is you got to keep trying. There's a little bit of trial and error to find what works for you, but you'll find something that works for you. And it's just, no matter what, no matter if food, we can get it to taste a little bit better and try different things, but no matter what, it's still important to eat as best you can. And there's different ways that taste can be affected. Sometimes patients feel like everything has no taste, or they have a kind of a cardboard taste in their mouth where everything tastes really bland. Other patients may have a more heightened sensitivity to a certain kind of taste where everything may taste, let's say, too sweet or too bitter or too metallic. So most importantly, as I mentioned earlier, that mouth rinse is key. That baking soda and salt mouth rinse is really helpful for those off tastes in your mouth because it does help to kind of cleanse the palate. Baking soda has a wonderful, refreshing way of clearing the palate before meals so that even if you have an off taste in your mouth, it can minimize it to make it a little bit easier to eat. So that's the first step, really the key. And then you have to just try different things and experiment with what works for you. So if things have no taste, you might have to try and experiment with some flavors and spices and seasonings as tolerated, of course, as long as your mouth isn't too sore. Try things that you may not necessarily have liked before, maybe pickles or adding some relish, let's say, on top of a meal, different kinds of condiments and sauces, even like a buffalo sauce or a different spice or seasoning like marjoram or thyme, things that you may not have ever used before may do the trick, may give a little bit more taste just to have the food have a little more enjoyment. Marinating meats is also a great suggestion because by marinating, it not only tenderizes it and makes it really a lot easier to chew. That tenderization process breaks down some of the tougher proteins that usually make it harder to chew. And it also gives it a nicer flavor because it's allowed to kind of soak into the meat a little bit. So that's a great suggestion to give meat a little bit of a better flavor. And those sucking candies I mentioned earlier for dry mouth are also a great, great trick for change in taste as well, to kind of give yourself a little bit of a boost in terms of taste, especially if you have an off taste after a meal. Even when things taste metallic or bitter, try to choose foods that already kind of have a neutral taste to them. So, for example, if meats have an off or metallic taste, we usually recommend choosing proteins that are more neutral, things like fish or chicken or beans, have a more overall kind of blandness to them unless they're, sauce or flavor is added. So that's a good thing to choose if you have kind of an oversensitivity. In addition, metallic taste can also be worsened by using things like iron skillets, canned foods, regular silverware. Usually I have patients swap out plasticware instead of silverware if they're sensitive to metallic taste. Sometimes even adding a little drop of a sweetener can help to kind of offset a metallic or a bitter taste. A few drops of honey, maple syrup does often do the trick, and it's worth a try. You'd be surprised how a little bit can go a long way and at least help to make the food. It may not be perfect, but it definitely might make it more tolerable, and it's a great, trial and error kind of a thing to experiment and find what works for you. And I'll mention this at the end as well, but since there's so many individual kind of methods that can work for each different patient, try to jot it down. Keep track of, what's working for you, what's not. It's a great way to talk to your medical team, talk to your dietitian, have that open communication just to discuss what's working, what's not. You can keep track, and then, your team can actually give you further suggestions, help to ensure that you're trying, all the options possible, and it's just a great way to keep that communication open. So one of the next side effects is smell aversion. This usually comes along with nausea, which I'm going to talk about next. But smell aversion is, it's tough. Usually it's tough to be around food when it's being prepared. So simply because the smell is often enough to just make you not want to eat at all. Generally, we try to say, as long as the weather is, nice enough outside, try to keep a window open, keep the air circulating to minimize the smells. If there's some kind of negative pressure fan or downdraft or something like that associated with the stove, try to have that on so that it can kind of remove some of the unnecessary odor. And sometimes, it's just as much as trying to choose foods that don't have, generally when we cook, obviously, there's more of an odor. So cold, room temperature foods instead of hot foods tend to have a stronger smell. So, if there's a day where the smells are just really bothering you, it might be easier to have, let's say, something like egg salad on like a piece of toast or pita, or even by itself, instead of having, let's say, scrambled eggs. Because it's cold, it generally should have less of a smell than cooking an egg itself. So tuna salad versus actually cooking a piece of fish. So the colder foods may work better when smell is really bothering you. And then you can also try to adapt your environment through different kinds of scents that might kind of offset the smell of food. So maybe lighting a candle or using a diffuser might help to kind of cover up some of the unpleasant odors and, make cooking a little bit more tolerable for you. So then we're going to talk about nausea, which obviously smells can also worsen nausea as well. So it's important to kind of cover all those bases as part of treatment for nausea and vomiting, in addition to some of the things I'm going to discuss. So nausea and vomiting is interesting because it's one of the things where if you stay ahead of it, you can really help minimize it. And the reason why I say that is because often patients think that not eating is going to make them feel better. Immediately when they start to feel that queasy feeling, they may avoid eating altogether. But what I tell my patients all the time is that an empty stomach makes nausea worse. So it's so important, even proactively, before, and usually nausea and vomiting gets worse during the days of chemo. So it's important to proactively consume small, frequent meals. Eat a little bit throughout the day to help prevent any really awful or bothersome nausea. And the reason why that works is because if you have a little bit of food in your stomach every couple of hours, it helps to prevent some of the irregular contractions that can cause that really uncomfortable nausea and queasy feeling. So it really, really does help. And it's a great strategy to start ahead of chemo, even throughout all of your treatment, even during radiation days and after surgery. Small, frequent meals is a really great suggestion and strategy to incorporate because it's a great way to get in enough nutrition and do it in a manageable way so it's not overwhelming. So that's a really important practice to implement. And then once again, as I mentioned with the odors, cold foods tend to be a little bit more tolerable. Bland foods, things like, plain pastas, crackers, bland, starchy foods kind of absorb the extra acid that can kind of give that indigestion and uncomfortable feeling when you're feeling queasy. You definitely want to limit things that are really heavy. So pizza, for example, or let's say a lasagna is not a really great food choice if you're feeling nauseous because it's definitely very heavy, high in fat because of all the cheese and the grease. So that's not a nausea-friendly food, whereas, like, let's say a turkey sandwich or a scoop of chicken salad or egg salad for somebody who needs something softer, or a soup or a chicken soup would be a better choice for somebody undergoing nausea and vomiting. And once again, for all these symptoms, we have some great recipes within the new booklet that we just put out. And there's great recipes that are dedicated for each of the different symptoms, which you can check out. So another great thing for nausea is ginger. And my patients used to use it all the time, especially after chemo. Ginger tea, if you can tolerate ginger candies, sometimes they are a little kind of tart. So if you're able to tolerate like a tartness, ginger tea is a little bit more mild. But ginger in and of itself, the plant chemical in ginger is actually really similar to the chemical that's in the anti-nausea medicines that you get during treatment. So ginger is a great natural way to relieve some of those contractions in the stomach. It actually helps calm the muscles of the stomach. It helps to kind of reduce nausea and helps to calm things down so that the queasiness can stay at bay. So it's a great thing to try. Sometimes I even have patients put, like if they're making a chicken soup or even kind of using a chicken soup that you have in the freezer or something, somebody brings over for you, throw a couple of shreds of ginger into the soup. It's a great way to get in some ginger and help with nausea. And then some kind of non-food approaches, deep breathing, meditation, because a lot of times when we feel nauseous and then we start thinking about it and we get anxious that we're going to get nauseous, sometimes that makes it even worse. So try to stay calm and relax and, take a deep breath. That can help kind of keep you calm so that the, unnecessary nausea can stay at bay. But if it's really bothersome, definitely bring it to the attention of your physician, your nurse, dietitian. They may need to make an adjustment in your anti-nausea medications, or you may need to adjust the schedule of how you take it. Some of my patients need to take medication, the anti-nausea medication, at least half an hour to an hour before mealtime in order to have it work appropriately so that you're able to tolerate your meal. So it may be change in the timing of when you take it. You may need to take it around the clock during the day. They may need to switch it out. Sometimes different ones work better for different people. So definitely be sure to discuss it openly because there are things that can help if nausea and vomiting are really an issue. And make sure you're drinking enough. It's important to stay hydrated, especially if you are having vomiting. That can very easily dehydrate you. So, if it's, occurring more than just once a day, it can dehydrate you very quickly. So definitely bring to the attention, once again, of your physician and medical team. And as I mentioned here, just to kind of reiterate, that eating, even though you don't feel like it, eating on an empty stomach can make nausea so much worse. That small, frequent meals is so key. Every couple of hours, just try to have a little something on hand, a little snack, even if it's one of those nutritional drinks or smoothies or something that you make at home is key. Okay, so now we'll talk about weight loss. So as I mentioned in the beginning of the presentation, weight loss is often something that can present even before you've realized that you have cancer. It can occur even from the very, very beginning and can slowly progress throughout treatment if you don't take a handle of it. So it's important to monitor it closely with your medical team. You don't want to lose too much weight, especially all at once, because too much weight loss also impacts your muscle mass and definitely can affect, how well your body is able to heal and tolerate the treatment. And even potentially patients who lose too much weight, they may even need to adjust the dosage of your medications and your chemotherapy. So it's important to keep a close eye on your weight and to communicate with your team to come up with a good plan to manage. So that small, frequent meals is also a really great strategy for maintaining weight and getting in enough calories, because you're eating a little bit at a time so it doesn't get too overwhelming to sit down to one meal. And you can also optimize nutrition that way, because oftentimes when you don't feel like eating and you sit down to a regular meal, it's just too overwhelming and too cumbersome to tackle. So if you're eating a little bit at a time, most of my patients can get in a lot more calories that way than just eating their 3 regular meals that they were used to eating. It's also important to make those meals count, make every bite count, so incorporating lots of high-protein and high-calorie foods. So protein foods your body really needs for healing and to keep your muscle mass strong. Things like, soft meats, fish, poultry. The marinated poultry works great because it really tenderizes it. Scrambled eggs, dairy products like yogurts and cheeses and cottage cheese and things like that. Nuts and nut butters, beans. All those are great sources of protein. You can even get in a lot of good protein and calories from smoothies and nutritional drinks. And like I said earlier, your dietitian and healthcare team can help you find one that's great and tailored to what you need. And then high-calorie foods. It's really easy to add more calories to the foods you're already eating. Even with a few slices of avocado, sprinkle or a dollop of olive oil or butter, some nuts, extra nuts or seeds, as long as you tolerate them, things like chia seeds, shredded cheese, extra sauce or gravy, nut butters, or even sneaking in some dried fruits. Those are all really high-calorie additives, so it's a great way to fortify whatever you're already eating, and it really does go a long way. So your dietitian can help you find ways to add those foods appropriately within your own meal plan. And those will actually work really well even beyond treatment as you're into survivorship and you're trying to maintain your weight. Great things to continue. And, the dietitian usually helps you to find healthy ways to add in not only the fats to add calories, but healthy fats, good heart healthy fats, like the avocado and the olive oil that also have good heart health benefits. So here's an example. Let's say, for example, if you have oatmeal for breakfast. So some good things to add calories would be things like peanut butter, dried fruit, granola, seeds, or even some heavy cream, maple syrup. Those can all add extra calories to what you're already eating in the oatmeal, and a good way to add at least an extra 100 calories or so. If you have soup, let's say, for lunch, you can also make it a cream soup. Add some shredded cheese in the soup. You can add a dollop of sour cream on top, slice some avocado on top, even spoon some extra olive oil within the soup as you're reheating it. So those are some easy ways to fortify a soup or a breakfast like you're already eating. Okay, so now let's move on to some of the digestive symptoms that can get kind of bothersome. Constipation and diarrhea are quite typical and can occur throughout treatment. They may get worsened on the days surrounding chemotherapy. Constipation is definitely a side effect of a lot of anti-nausea medications because they're slowing down the nausea. So they usually have an unfortunate side effect of slowing down the digestive system itself and can cause a little bit of constipation. Or if you're not drinking enough, definitely if you're dehydrated, the regularity is much more difficult in terms of having bowel movements smoothly move through the digestive tract. So it's important to stay on top of constipation by including enough fiber. If you're able to tolerate it, obviously fruits and vegetables are a great source of fiber, in addition to the nuts and the seeds, and any way you can kind of fit them in, even if it's within a softer food, even if you can tolerate, let's say, canned peaches or applesauce as opposed to a whole apple, that's still a great way to get in a food that has some fiber. Oatmeal as opposed to a piece of whole wheat toast, but that's a softer version if need be, a way to get in good fiber. It's also helpful, like things like prunes, prune juice. There's a great recipe that I would use with my patients that's like a prune and applesauce together. Even hot beverages work great to stimulate because it stimulates the digestive movements of the GI tract. It helps promote a bowel movement. And as I said, make sure you're drinking enough because dehydration can really worsen constipation if you're not staying on top of it. And oftentimes when the bowels are not moving quickly, we have more of a tendency to not be able to pass our gases from our foods like vegetables and a lot of the cruciferous vegetables, cabbage, broccoli, cauliflower, peas, beans, things like that. So if we're kind of blocked up, those don't have a way to move through as quickly and can cause more gas and painful bloating. So if you are tending toward constipation, those are foods you might want to minimize during that time to avoid any unnecessary, unnecessary extra discomfort. And exercise is really a great, great, great thing to do for constipation and regularity. Any little bit of walking, even around the room, or any bit you can fit in, as long as your doctor and your team are in agreement, is a great way to get the bowels moving, and it really, really does help. If you do need extra help, talk to your doctor, talk to your dietitian. They can help you perhaps with a laxative or a medication if you do need something to stimulate further. And then we've got the opposite discomfort, and a lot of times patients, will experience diarrhea at some point, whether it's just one or two loose bowel movements here or there, or it's something that persists. There are things you can do to help. We generally, once again, it's very similar to nausea, where we have you avoid a lot of the heavy, greasy, fried foods, things that can be more irritating and cause indigestion in general. And we tend to focus on things that are a little bit more bland, things that are a little more binding, so things like bananas and oatmeal, applesauce. Those tend to have a little bit of a binding effect when you have a loose, watery movement. Be sure to stay hydrated, because just like nausea, diarrhea can very, very quickly cause dehydration. So be on top of that. And if you do have more than 3 loose bowel movements for more than 2 days, it is important to make sure your medical team is aware, because you can very easily become dehydrated and may need IV fluids. So communicate that very quickly to make sure that you get the help that you need if it becomes bothersome. And in addition, sometimes patients find it helpful to include, kind of proactively help with some of the looser bowel movements by including foods that have healthy bacteria and probiotics. If you can tolerate dairy and don't have lactose intolerance or isn't made worse with the diarrhea, sometimes things like yogurt, kefir, different kinds of fermented foods can sometimes help give a natural source of probiotic. And then in addition, sometimes patients will, can safely take a probiotic supplement as long as it's under the guidance of your healthcare team. That would be very helpful for some patients where the diarrhea may also be related to an imbalance in healthy bacteria. And and then just make sure to drink enough. It's really key to stay on top of it and prevent dehydration. Okay, so now that we've talked about a bunch of the different side effects, that's really just the tip of the iceberg. There's definitely so much more that each individual can do, and I would say the best way to keep track of how your different food modifications and how your diet is affecting your symptoms and affecting your weight and how you're feeling is keep a symptom journal and a food journal. We have a great sample of this within the booklet that you can actually tear out and make a copy of it, and you can even use it to show to your healthcare team and share with them. It's a really great way to track how things are working for you. So if you've made some of the modifications that we've discussed today, you can track and see how it's helping. Is it making a difference? Maybe you need to try something else, or maybe it's working really well. And it's a great way to communicate and show your healthcare team to be really proactive about the nutrition-related side effects. And it really helps the dietitian. It helps us to estimate whether you're getting in enough nutrition, see if you're getting in enough calories and protein. It also helps you as the patient, even as you're completing treatment and you're a survivor. It helps you to be accountable. It helps you to ensure that you're, eating healthfully and applying good nutrition strategies to help keep your body healthy and to heal and stay strong even after treatment. So that's a really important takeaway that I think is important to remember and try to include if you can. In addition, just to kind of summarize, it's important to help enlist the help of your friends and family. And I know Dave's and Thea are going to go through this a little bit and how that helped them. Be prepared. Cook in bulk on the days when you have more energy. Just, take advantage and optimize your nutrition and have things on hand and do more when you can. And then set an eating schedule. Like I said, that small, frequent meals is key. Try to make a plan and stick to it. Enlist the help of your team to make nutrition a priority, and you can really be successful. So I look forward to hearing what the rest of the panelists have to say tonight, and to answering some of your questions later. And I thank you again for being a part of it.
Well, thank you, Jessica. That's some really detailed information that hopefully a lot of the people listening to this can use. Next, we're going to turn it over to Dave and Thea, who are going to share their personal experiences with head and neck cancer.
Thank you, Claire. If I could just you see this first slide here. Basically, I'm going to just sort of set the stage. I don't want to dwell on all the surgeries, but as you can see from this long list here, when you get into head and neck cancer, there's often a long series of things that have to be done. One thing begets another, and so on. This is my second bout with cancer in the same place. I actually had oral cancer diagnosed back in 2002. They cut out a little piece of my jaw at that point in time. They thought they got it all, but it came back in 2015, and at that point they had to do a radical mandibulectomy, which essentially means they cut out my jaw from the chin all the way back to my ear on one side, and left me without any teeth. So immediately I lost the ability to chew much of anything, simply with 3 teeth on the one side. I came out of that surgery with a tracheostomy tube and a feeding tube, so unable to breathe or eat without that assistance. That took probably a month to get rid of those. And then following that, I had the radiation treatment, and that resulted in burns in my mouth, which again one thing led to another. They wouldn't heal, and so I had to go into hyperbaric oxygen treatment to get them to heal. And this is all prior to the second surgery later in 2016, which restored the jaw by taking part of my leg and grafting it into my face. And that followed with physical therapy for the second time. The first time to handle the lymphedema that was a result from the radiation. The second time to handle the loss of mobility from the toughening of the tendons in my neck and my jaw, and so on and so forth. I'm just now at this point getting to where I've had the dental implant surgery, and I'm getting back to permanent teeth, or semi-permanent teeth at least. So I'm finally now able to bite into a sandwich. All the simple things that we take for granted. So it's a long process. That's the point I'm trying to make. It's a very long process, and it's important not to give up, because there's a lot you have to work with along the way. The getting back to the chewing thing, having only teeth on one side of my mouth and on only half of a jaw at that immediately led to the inability to chew up too much in the way of food. Of course, my mouth was all sore from the surgery. And then what you don't use, you lose. And this is something that needs to be stressed. The oral cavity shrinks down if you don't use it. So you're taking smaller and smaller spoonfuls of pureed foods and cream of wheat and Jell-O and things of that nature, because that's all you can handle, and suddenly you realize that you have lost the ability to open your mouth very far. When they finally get around to putting the teeth in, I think the standard that they look for, the dentists look for, is for you to be able to open your mouth wide enough to put 3 fingers in, one on top of the other, and I think I get 1.5 at this point. And that takes some work to get that back. The dry mouth, definitely. This, primarily as a result of the radiation, but also because of the fact that in my case they took out all of the salivary glands on one side. So not only have we lost half of the salivary function right off the bat, but now the radiation impacts the remaining salivary function, so all you have is sort of, the glands on one side functioning at low efficiency. There's a number of things that you can do to combat that. Nothing is perfect, but everything helps. One of the things I want to share is at nighttime, and this is something that I've heard from lots of different head and neck cancer patients, is that at nighttime it's the worst, when you lay back and your mouth just dries out completely. People would have to get up and rinse with warm water several times in the night and so on. There is a product out there which you can put into your mouth that actually adheres to the gums, and it'll sort of release over 6 to 8 hours a minty, sugar-free taste in your mouth, which stimulates the salivary glands to do what they can, and that helps a great deal. As far as getting through the day, the loss of the salivary capacity means that you really have to find your tipping point. Chicken dry is almost impossible to eat. You put chicken in gravy, you can eat it. Thea's laughing here. The bread, I always loved a good piece of fresh baked bread. Without butter, it's not going down. There are all kinds of things like that. You just have to keep experimenting with to see exactly where that tipping point is. Somebody handed me a chocolate-covered pretzel stick one time, and I ate that down until I got to the point where the chocolate was gone, and I couldn't eat the rest because that was dry. But the chocolate stimulated the salivary production. Not that I'm suggesting we put chocolate on our food, but it's just an example, the tipping point. The burns in my mouth were produced by the radiation itself. It burned my tongue, it burned the inside of my cheek, and that was probably the hardest thing for me to get through, that first fall there after the radiation in 2015. Anything mildly acidic was just intolerable. If I tried to eat spaghetti or any Italian food like that, I couldn't do it. At one point, everything stung my mouth. I had a bottle of viscous lidocaine, and I would put it in my mouth and come out and eat for about 10 minutes until it wore off, and then I'd run back to the bathroom and put on some more lidocaine, and then run back out to the kitchen and eat a few more bites until it wore off again. That thankfully didn't last too many weeks. Once I got into the hyperbaric, then the burns healed. But during the course of this thing, your tastes do change. Most definitely. You get a loss of it after the radiation. Nothing tastes like anything in your mouth for a while. And then you discover that things that you were eating suddenly don't taste good anymore. With my search for soft foods that I could consume that would give me enough calories to live on, one of my favorites was always cottage cheese. And so that became a mainstay for me. It gave me protein. There was some fat in it, so I kept up my weight. But all of a sudden, I couldn't eat cottage cheese. It tasted sour. And even now, to this day, there are only certain brands of cottage cheese that I can eat. There are other ones that taste sour. I can't eat them. I'll have a spoonful, and I have to throw it out. Yogurt is another one. I can't eat yogurt anymore. It all tastes sour to me. Black coffee, that's gone. I used to drink nothing but my coffee black, and now I have to have creamer in it. I cannot tolerate the taste of black coffee. But again, it's just a question of experimenting until you find what works. I had some family come to visit during the winter of 2016, and they wanted to get some Italian food at a local restaurant, and we brought some home. I thought, well, I'll try it. I got some ravioli, and I bit into it, and it started to sting, and so I rinsed my mouth out really quickly, and I thought, well, what can we do here? So I took the ravioli, and I actually rinsed them off under the tap water, put them back on a plate and put a white sauce on instead. And that did the job. So I could eat it that way. I just couldn't eat the tomato-based sauce. You have to keep working at it till you find what it is that works for you. My son helped. He gave us a Vitamix during the course of this, so that enabled us to try the pureeing. I note a caution about that. There are a lot of foods that you can puree, but they don't all look too good. You can puree a pot roast, for instance, and you can eat that pot roast in gravy, but don't put beans in there, because there's nothing that looks quite as unappealing as green goo coming out of the blender. So you have to experiment. Some things work, some things don't. At this point, I'm finally getting back to where I can eat nearly everything, with a couple of things that I've just adjusted long term. And again, attitude is everything. Don't give up. Keep with it. My wife has been my mainstay through all of this. She's put up with a lot of whining. It helps me out in the kitchen.
Am I supposed to say something now?
I think you are.
Hi, this is new to me. I took care of his feeding tube, and I took care of his surgery scars before they became scars. When he went to rehab, I watched what the nurses did so that they would do their job correctly. I'm not sure what else to say. I mean, I just wanted him in my life. I didn't want to lose him, and I did whatever I could to make sure he was comfortable and that he could be as happy as he could be with the situation he was in. And I kept reassuring him that even though he had this surgery, he still looked right to me. He still looked like himself. And I just wanted him to know how much I cared and how much, even though he's changed, he hasn't really changed. I love him just the same. And I'm very thankful that he's still here, because it was kind of touch and go a little bit as far as I was concerned. And, it just didn't look good for a while. And I will always be thankful.
That first surgery in 2015 was 15 hours long.
Yeah.
So you can imagine what the mood was in the waiting room that night.
And I stayed awake the whole time, and I just waited. They said it wasn't going to be as long, but it ended up being that 15 hours. And I had almost got to the point where I didn't think he was going to come out. But when he did, I was very happy. The hard part of the whole thing that time was when he came out of surgery and the doctor came in and told me what they did. And he heard what the doctor said, and he mouthed the words, "Do you mean to tell me I don't have a jaw?" And I said, "That's correct." And I believe I saw tears in his eyes, because they didn't tell him at that point what they had to do or what came out of the surgery. It was different from what he knew when he went under. So he had a whole different thing that he had to deal with, because at the time they were supposed to reconstruct his face. And they did the surgery, they did it differently, and he never got his reconstruction at that point. And that's where we are now. It took different surgeries and different things that different doctors did to get to where he is today, because they changed the surgery at that time. I'm not really good at this. I don't know what else to say. I mean, I'm happy that I still have him. That's all I can say over and over. because it was so close. And like I said, I didn't think he was going to come out of that surgery, and I just sat and waited. And I cried when I saw him, you know, because it wasn't what I expected. But I looked into his eyes. He opened his eyes, and the first person he saw was me. And that's what I told him. When you open your eyes, you will see me. So I made sure I was there. And I told him that he looked like him. I kept reassuring him that he still looks like him.
She lied. That's okay.
I did not lie. To me, he still looks like him. Okay? Nothing's going to change that for me. I mean, he's the best person in my life. He's the one I can depend on. And even when he was sick, I could still depend on him. I took care of him. He took care of me. We always take care of each other. And if I had lost him, I don't know where I would be. I don't see my future without him. Plus, he lets me have animals. I like having animals. I don't want to cry. You know. I don't know. I don't know what else to say right now.
Yeah. We can turn it back over to Claire.
Okay.
Thank you, David. Yeah, that's really helpful to hear it from a patient's point of view and from a caregiver's point of view of some of the struggles that you faced and how you coped and what you were thinking. So thank you for sharing from your heart. I'm going to now ask Amanda to talk to us a little bit about the Head and Neck Cancer Alliance, our partner on this project.
Thank you. And thank you, Dave and Thea. That was a really moving and helpful story that you shared, and thanks, Jessica, as well. I won't take a lot of time because I know there's questions that people have, but I'm with the Head and Neck Cancer Alliance, and we're a nonprofit whose mission is to advance prevention, detection, treatment, and rehabilitation of oral head and neck cancers. And we do that through public awareness, research, advocacy, and survivorship. Our organization started back in 1984. We were then called the Yul Brynner Head and Neck Cancer Foundation after the actor who famously did a commercial promoting the relationship between tobacco and head and neck cancer. And over the years, our focus has broadened and our name has changed, but we remain committed to increasing awareness about head and neck cancer. So moving on to some of our core programs. One is our ambassador program. This is a way that you can participate if you're a head and neck cancer patient, if you're a survivor, if you're a caregiver, and you'd like to share your story with others to help encourage early detection or promote research or advocate. So we look for people to participate in a number of different ways to make a difference. If you're someone who's comfortable speaking in front of groups, that's one way to be involved, and we can help connect you with speaking opportunities. There are ways to help with our support community or by providing research feedback on research projects, or we're also working on starting a mentorship program for someone that's newly diagnosed. And you can find more information about that at our website or any of this by emailing us at info@headandneck.org. Our signature program that we're probably most known for is our annual screening event. It's the Oral Head and Neck Cancer Awareness Week. It's an effort that largely takes place in April each year. In 2019, it'll be the week of April 14th. Just last year, we had 535 sites participate in the U.S. and abroad, and we screened more than 45,000 people. Of those screened, over 4,000 were referred for follow-up and 723 for immediate consultation. So a key message of our campaign, and we do a lot of public awareness around that, is early diagnosis being key to successful treatment. And there are many ways to get involved with this screening effort. We are always trying to add additional screening sites. So if you have medical or dental contacts that you may know that would like to participate, that would be wonderful, and I can talk to you about that. We also have a gas card program. We provide BP or Exxon gas cards in the amount of $50 to head and neck cancer patients because we know transportation can be an issue for many people who are traveling for treatment. And this assistance is made possible by a Smash Cancer tennis tournament that we have, as well as private donors. So we have an application, again, on our website that you can download, or you can email us, again, at theinfo@headandneck.org. Our helpline, the number there is a dedicated 800 number and email system to support patients and caregivers. And I know that's something that was talked about at the beginning of the program, but it's a really great resource that you can call and make it easy to receive support. The helpline is answered by trained and compassionate information specialists and social workers who are licensed to help provide emotional support and help people affected by head and neck cancer get practical assistance as well. We also have a support community, which is online through Inspire. You can register for an account online and join this community, and it's really peer-to-peer support and a safe environment to connect with others who are experiencing head and neck cancer or who have experienced the diagnosis and treatments and outcomes similar to yours. In the forum, you can start or respond to discussions, you can upload photos, you can search for specific topics to find members who share the same interests. Then we also have local chapters. Right now, we're a national organization. We also do screenings internationally, but we have a growing network of chapters, which are right now in Pennsylvania, Massachusetts, Connecticut, Florida, Indiana, Louisiana, and South Carolina. And our chapter volunteers work passionately at educating people about oral head and neck cancers and the importance of early detection and prevention. So if you are interested in volunteering, or you can contact your local chapter, and if there is no local chapter where you live and you're interested in finding out about starting one, again, please contact us. Finally, so education and awareness, that's something we already have a strong focus on, and we are working to increase that through our patient caregiver network building, PR campaigns, getting national spokespeople involved, podcasts, videos geared towards head and neck cancer patients and families, and more materials for clinics and the public to access. We have a volunteer board of directors that include the top experts in their fields across the country related to head and neck cancer, and they greatly help with this effort and help us stay on top of the latest research. And speaking of research, we all know that clinical trials and research are helping save lives and improve treatment options. So as part of our health education initiatives, we're working to provide information on what clinical trials might be available and to help patients decide if this would be a good option for them. So we have more information, again, about current clinical trials and research on our website. So that concludes the overview of the Head and Neck Cancer Alliance, and I appreciate being included in this webinar and appreciate your time. And I'll turn it back over to the cancer support community.
Thanks, Amanda. The Cancer Support Community, in partnership with the Head and Neck Cancer Alliance and also the American Institute for Cancer Research and then Savor Health, developed an Eating Well with Head and Neck Cancer booklet that contains both helpful tips for dealing with eating problems as well as recipes to cook to help with those specific problems. Those are available at our Eating Well with Head and Neck Cancer page, and Chelsea is going to let us know what the URL of that page is. I believe it's www.cancersupportcommunity.org/eatingwellhnc. And we will let you know that URL again at the end of the webinar. And if you can move to the next slide, I'm going to go ahead and you see the home page for our Eating Well with Neck Cancer information is that first URL. You see the Head and Neck Cancer Alliance's webpage there, as well as some other organizations that have good information for head and neck cancer. We would now like to open the discussion up to the audience. We may have answered some of your questions during the presentation. However, if you have any additional questions, please feel free to type them into the question and answer box that's on the right of your screen. So there are several questions that we've already gotten about feeding tubes. And so, Jessica, I'm going to turn these questions to you as the registered dietitian on the call. And the first question is one that I've heard people talk about before. Aren't feeding tubes just for people who are near the end of their lives? Shouldn't I be worried about getting a feeding tube?
Yeah, you know what? I think sometimes they have that connotation, but believe it or not, feeding tubes are really traditionally in the nutritional and medical realm meant to help a patient who has the inability to eat by the oral cavity or the inability to use their digestive tract or stomach to be able to temporarily supply nutrition during a time when they aren't able to do so by mouth. So even though it may be kind of have a connotation of an end-of-life kind of a care, believe it or not, at that point it's less effective in a terminal situation versus when it's actually a situation where the patient wouldn't be able to eat otherwise, and it is actually able to help them to receive proper nutrition to get through an event where they otherwise would not be able to eat. So especially the way we do it for head and neck cancer patients, with most of them have what's called a PEG tube or a percutaneous endoscopic gastrostomy tube. Very easy procedure to insert, and actually it's relatively easy to take care of, and it's not comes out relatively easily as well. So it sounds more scary than it actually is, and with the help of your nurse and your dietitian and your medical team, you can pretty easily learn how to take care of it and use it appropriately to help you stay strong and get the nutrition for that short time when you aren't able to eat by mouth.
Mm-hmm. And then if you already have a feeding tube inserted, where do you learn the exercises that you should be doing while you're on the feeding tube to both keep your eating muscles working and to keep your, Dave talked about his oral cavity got smaller. What do you do, and where do you find those exercises?
Yeah, it may depend on your facility. You may get them from the speech-language pathologist that's involved in your head and neck cancer program. The nurse or the person affiliated with, let's say, the GI doctor or the surgeon who put in your tube may have instructions to share with you that they use and give out routinely to patients, or there may be even a physical therapist or an occupational therapist involved with your program as well. So it can come from a few different sources on the medical team depending on how your team works and what kind of staff they have. But I would say if it's something that you don't receive, to ask for. And even the dietitian can advocate for you and help get you the information that you need. But it's definitely an important question to ask to keep those muscles working and moving, to keep them strong if you're not, even if you're not using them as much while you're using your tube.
Great. Thanks for that. And then one person just wanted to be clear, who do they talk to if they have difficulty swallowing, if they're starting to feel some difficulty swallowing? Is it the dietitian that they talk to?
I would say, definitely whoever the next visit is, if you have the next visit with let's say the nurse during your check-in right after treatment, or if it's the oncologist, whoever your next visit is, bring it to the attention of the person that you're seeing. I mean, most importantly, I think the nurses at radiation are the ones who are kind of checking in on you every day, or even the radiation tech. You can say, hey, you know what, I'm really starting to have trouble swallowing. Can I see the doctor today, or can you get the dietitian to visit me before I leave? Anybody in the facility can connect you to the right person. So I would just say speak up as soon as you can. Usually the nurse can grab the doctor, even if you're not scheduled to have a visit with him that day, and grab the dietitian as well. So I think most importantly it is just to speak up with the person that you kind of come into contact with at the next possible radiation treatment, whether it's the tech or the nurse, and they can grab the doctor and the dietitian, to help you out.
Great. And then several people have asked questions that have to do with, is there a list of foods that are easiest to digest? Are there food or recipe to go to when you're having digestion problems, whether it be diarrhea or constipation or even nausea? Is there a good resource for that?
Yeah, well, definitely in the head and neck cancer booklet, we have tons of recipes, and all of them are designed to be appropriate for the majority of the symptoms that I discussed today, to have easy to digest, very tolerable foods. In general, things that are well cooked. So think cooked versus raw. That's a good kind of rule of thumb in terms of easier to digest. So well-cooked vegetables, even canned fruits, are easier to digest because it breaks down the fibers. Very tenderized meats that are cooked in like a stew or a sauce or a soup are easier to digest than something that's just grilled or more dry, things that are marinated as well. And digestion also can be a little bit harder when the meals are high in fat. So in general, especially if you're experiencing diarrhea, nausea, higher fat foods are usually more challenging and can worsen those symptoms. So those are kind of the general rule of thumb, is things that are well cooked, in terms of meats, fruits, vegetables, and then avoiding a lot of high-fat, greasy foods.
Thanks. And then another question that I've gotten that really would go well to you, Jessica, as the dietitian, are questions about being on a fixed income, and so does it matter in terms of nutritional value whether you buy organic versus non-organic, whether you buy store brand versus name brand? Do those help with nutritional value?
Yeah, so I'll answer the store brand first. So the store brand versus name brand usually does not make a difference in terms of nutritional value. They should be equivalent. So definitely, if you're on a budget, it's okay to go for whichever's on sale, whichever is the most affordable per unit cost. And then, in terms of organic and not organic, the nutritional value in terms of fruits and vegetables, in some ways it depends on how they're grown, how long they've been sitting on the shelf. There's a lot of factors that go into how well they're retaining their nutritional value. I would say local produce is actually the most important. Because if you're getting it as fresh picked as possible, that's going to have the most nutritional value, whether it's organic or not. Obviously, organic, there's less pesticide residue. So when possible, if it's affordable, you can certainly choose that. The Environmental Working Group has a list of the best foods to choose organic so that you don't have to waste your money. You can focus on the foods that are most important to choose organic, like certain lettuces and berries, strawberries, apples, things like that are one of the higher level of pesticide residues. But when it comes down to it, fruits and vegetables are still important. Whether you can afford organic or not, they're still extremely healthy and really beneficial for you. So if possible, local farm stand, that's a great option in terms of maximizing nutrition value. And frozen. Even frozen is a great affordable way off-season to get in lots of fruits and vegetables and have them year-round, and have them, be packed with flavor and packed with nutrition because they're flash frozen at the peak of ripeness.
Great. And then somebody wanted the recipe for the baking soda rinse again. That's available in that booklet, and I'm going to have Chelsea move back one slide so you can see the URL for that booklet again. And then one more food question is, somebody is on the line who wants to know if the foods and drinks that are recommended both in the webinar and then also in the booklet are good for all cancer survivors, or are they just for head and neck cancer survivors?
Well, I think the foods that we mentioned are geared towards some of the symptoms that head and neck cancer patients go through, but it doesn't mean that it's not healthy for any cancer patient even after treatment, because in general the recipes were designed to be really healthy and nourishing, so anybody can certainly use the recipes. And, you know, even after treatment, thinking about once you're able to tolerate more plant foods, the key to good nutrition and survivorship is including as many plant foods as possible, lots of colorful fruits, vegetables, whole grains, beans, nuts, seeds, things from Mother Nature that contain a lot of good healthy antioxidants and plant chemicals that help support your body and keep your immune system strong and have lots of good cancer-fighting properties.
Thank you. So we have time for one last question, and I'm going to have this go to Dave and Thea. Someone wants to know your advice for skin care after surgery and radiation to help remove the scars on your face and neck.
Well, I used a lot of moisturizing creams and so on. I would put them on a daily or twice daily basis. During the radiation, the skin just kind of crisps up, and it's red all the time, and it very quickly dries up and scabs over. So yeah, the more you can keep it moisturized with some kind of emollient cream, the better.
Doesn't take the scars away, though.
No, it doesn't. It just keeps them from becoming as bad.
Yeah.
They keep the skin from drying out.
Right.
Great.
Just a good,
well, thank you.
Good body cream.
Okay, great. And I am afraid that we have run out of time. So we want to thank our wonderful panelists, Jessica, Amanda, Dave, and Thea, for contributing their time and sharing both their professional and their personal information with us, which I hope will be helpful for a lot of people. And then we also want to thank our program supporter, Bristol Myers Squibb, for funding this program. Please take a moment to complete our webinar evaluation survey, which you will be automatically redirected to. We greatly appreciate any feedback you may have. Thanks for your participation, and have a great evening.